I would like to welcome all of you today to a little bit of this and a little bit of that. I am Andrea Sopko, and I am one of the instructors here at CanScribe Career College. One of the things we learn through transcription is we are putting together so many things that we have learned. Every single thing, whether it be English or medical transcription or whatever. So today we're going to visit some topics from the CanScribe MTHDS course material, as well as general medical transcription skills. I need to mute somebody. Hold on, please. I'm sorry. Okay. Transcription skills, resources, and ways of sharpening your thought processes. We will address any questions from our participants, and we will ask questions of our participants as well. Did someone have a question already? Oh, it's you, Mr. Dembones. You said you prefer that we begin with the skeletal system chapter? Well, certainly, but you do realize that we have attendees and our guests should have the privilege of going first. I guess just this once it won't hurt. So you're really into bones, Mr. Dembones. That may remind people, if they're not too old, about that song, your foot bone connected to your heel bone, and so on and so forth. Well, you certainly are a living example of those lyrics, aren't you? That is what we're learning when we go through the skeletal chapter. Now, your toe bone is connected to your foot bone. Does anyone know what the real name is for toe bones? Well, those are those phalanges down there, and your metatarsals. Your foot bone is connected to your heel bone. What's your heel bone called? The calcaneus. Your heel bone is connected to your ankle bone. What is that ankle leg bone called? There are actually 3 bones that make up the ankle. Here we see one of them, the tibia. The other 2 are the fibula and the talus. Your leg bone is connected to your knee bone. And what do we call our knee bone? Would anyone like to answer me? I'm looking at the chat window. Can you tell from this diagram what the knee bone is? It's the patella, okay? And your knee bone is then connected to your thigh bone. And would anyone like to please type in the chat window, what is your thigh bone called? Thank you. Yes, all you brave people that went out there and typed in there. I appreciate that. Thank you so much. It's the femur. All right, your thigh bone is connected to your hip bone, and what is the name of your hip bone? Well, you know, the song makes it sound so simple, doesn't it? But there's actually 3 bones that are involved in your hip. And as you can see here, it's your ilium, your pubis, and your ischium. Your hip bone is then connected to your backbone, and the backbone is also known as the, anyone? There are a couple answers that you could fill in here. Good, Lynn said spine. And what is the spine made up of? All those little things on the right-hand side, all those little gnarly looking things are called vertebrae. Yes, you guys are rock stars. Well done. Now, your backbone is connected to your shoulder bone, and you know, like I said, they make it sound so simple, but your shoulder bone is really numerous parts. It's your acromion. It could be your clavicle, excuse me. It just depends what part is broken, or what part of the bone we're referencing. In human anatomy, the acromion is from the Greek meaning acros, or the highest part of your shoulder. It's a bony process on the scapula or shoulder blade. The acromion is a continuation of the scapular spine and hooks over anteriorly. Now this is all connected to your head bone. And our head bone, of course, is called our skull. Very good, Judy. She is ready. She is ready with the answers. Okay. Now, as you can see, the cervical vertebrae in red there, spinning around, are the ones that connect the head or the skull bone to the rest of our body. And on the left of this picture, os frontalis, os nasal, os parietal, os temporale, I don't even know if I'm pronouncing that correctly, it means bone. So that's your frontal bone, to put it in English terms, your nasal bone, your parietal bone, and we can see where these are, which really helps when we're doing a report. It helps us visualize what's actually going on. So if their mandible is broken or their maxilla, that means they're having what kind of issues? They're having a broken what, probably, if you look down there. Very good. You guys are very good. A broken jaw, exactly. Now, this is something I learned putting together this webinar. So you wonder, how does the muscle attach to the bone and how do all these things go together? Well, there is this thing called Sharpie fibers. I just learned this myself. Like I say, we're always learning something new. And these fibers are a matrix of connective tissues consisting of strong collagen fibers, and they connect the periosteum to the bone. Now, at the bottom of this slide, I have the explanation of what periosteum is. It's vascular connective tissue enveloping the bones. And the lamella is a thin plate, scale, membrane, or layer as of bone, tissue, or cell walls. So the periosteum, and you have to remember that these bones are alive. You know, they're making bone marrow inside. The muscle's alive that's connecting to them. Sharpie fibers attach muscle to the periosteum of bone by merging with the fibrous periosteum and underlying bone as well. So we talk about rotator cuff. You know, people tear their rotator cuff. Well, all of these bones make up the rotator cuff. You've got a scapularis, muscles. Your scapular muscle, your supraspinatus, and your infraspinatus, and your teres minor. These are all the rotator cuffs, which are 4 of them. So if you tear one, they need to know which one it is, but you can probably still function. The skeleton makes up almost 1/5 of a healthy body's weight. All other parts and tissues would collapse without this framework of fused and individual bones. The average skeleton has 206 bones, and approximately 1 in 20 individuals have an extra rib. Now, whenever I heard that, I thought it would have been a rib down where all the other ones belong. But look where it is. It sort of juts out up there by your clavicle. Very interesting. Now, as we go through the reports and people ask us questions like in Pure Chat or whatever, a lot of these answers might have been found in the course material. And, you know, once we get through the course material, we sort of put that in its little place on its little continent, and we're in DictoScribe working on our transcribe reports. But a lot of that course material has information that we can refer to later on, and it will help us in our transcription journey. So some of the things that come at the end of every chapter are abbreviations for that topic, combining forms, common lab tests that you might experience, common diagnostic procedures, and a vocabulary list. Now, to make Miss very good, Micah, she said she always uses the vocabulary list. That is wonderful, and I hope it helps. Now, combining forms mean prefixes and suffixes. Any combining form that can combine to a root word or whatever. And some of the ones in the skeletal are here for you to see. Calcio for calcium, carpal for wrist, carpal tunnel syndrome, right? Cervical, cervicalgia, neck pain. And you can see these are some of the things available to you in the course material. Now, I would like you all to use the following combining forms and give some skeletal terms. Can someone come up with some terms, some medical terminology words using patel or patello? Wilma's asking Micah if she puts her vocabulary list into her word lists. You two, yeah. You guys, we can see if Micah wants to answer. Maybe Micah doesn't have a word list. Maybe Wilma does. Okay, so Lynn, take the word patello and make a big word out of it. Micah said she makes a separate word list for each chapter. So, patellotomy, patellofemoral. There you go, Lynn. That's a good word. Patellofemoral. And I'm sure we've had that in some of our transcribe reports. That probably was sort of hard because right off the top of my head, it's the only one I can think of is patellofemoral. How about brachio? Can anyone come up with some answers? Brachiospastic. Interesting. Brachiocephalic. Very good. And brachioplasty. Yeah. Good. Patelectomy, for someone having their patello removed. I don't think it would have two T's though, Wilma, but thank you for joining in. I love it. Brachioradialis. Good, Shauna. You guys are on it. How about costo? Two L's, right, Wilma. Costovertebral. Perfect. Good. And while anyone's thinking of more costo words, how about fibro? Costochondritis, yes. Fibromyalgia, yes, good. And you can see how this, or how about fibrocollagenous, which means fibers that are made out of collagen, which we saw, whatever. Very good, I appreciate everyone joining in. Okay, how about kypho? I love this woman. So even though you can see she is bent over, but she does have, very good, Elizabeth. Perfect. Well done. All right. Now we have some more words because we're not going to let you get off with just those few, okay? Kyphoscoliosis. Good, Shauna. How about ortho? There's a famous one. Oh, how funny. Orthopedics, orthodontist, orthodontic. Yes. And there's patello again. I can't believe I put the same word in there. I'm ashamed. How about poly? Polydactyly. I was thinking of that same word, polymyopathy. My cat. I love it. Very good. Okay. All right. Now I've got to move this. I don't know if you can see me moving these things all over. Now how about some suffixes? So we've done a lot with prefixes. How about using suffixes? We already did the one for Malaysia. I think someone threw that one in there, up there with another So there you see we've got a prefix and a suffix combined to make one word. Trophy. Hypertrophy. Good, Elizabeth. And osteoporosis. Good. And with Malaysia, I was thinking of chondromalacia. So you see how we can find all these types of words. If we're hearing them in a dictation, we might be able to find them in one of our, ends of one of our chapters. Now, disc and disc with the C or the K are acceptable variations. They're used in reference to anatomical and surgical references for this round, flat, regular, and regularly condensed plate of material. However, whenever you're using the word disc, when it has to do with eyes or ophthalmology, like your eye has a fundus and a disc, there's a cup to disc ratio, you always would use the C. Think of it as I see with my eye. Very good, Micah. She uses C equals SEE for eyes. so she remembers which form of disc to use. Now, I found this interesting because we always type about bulging discs or herniated discs or a thinning disc, and this slide here, this picture, lets you see just exactly what that means. A normal disc has a nice layer, looks like an Oreo double stuffed cookie sort of there, of disc material. The degenerated one is falling apart, you know, and it's not so good, it's not solid. The bulging disc, as you can see, has a little bubble bulging out of disc material. The herniated disc, that one has completely blown out. It's like a hernia in your intestinal wall, you know, when it blows out of your intestine and then they have to go in there and sew it back. You can see where this person also has, this person's a mess. If this was all one person's spine, can you imagine? The thinning disc, you hardly have any material cushioning between the vertebrae, and then disc degeneration with osteophyte formation. You can see it's making little projectiles there of bone that would really hurt if they hit any of your nerves. Okay. Now, we've spent a lot of time on the skeletal system, and we think it's time to move on and review some other topics. Why do you think family history is important? What's a major heading? Formatting, acronyms, account specifics. When you get to medical report formatting, when we're actually doing a report, we're juggling whether or not something is a major heading. We may be juggling whether or not something should be a new paragraph, whether or not we're hearing what we think we're hearing. And we remember not so very long ago we went over a lot of this in medical report formatting. You just may find some of your answers there. Having an idea of what to expect helps one anticipate what to listen for during dictation. In the medical report formatting chapter, parts of various medical reports are discussed. In each report type, there is one constant that as each topic changes, a new paragraph is needed. This new paragraph may be dictated as a major heading, which means it's not a sentence and it should be formatted as a major heading. Being able to anticipate the major headings you will hear and the information expected to be discussed in these major report sections will help toward a successful medical transcription for both you and the patient. Now, what can we find? What type of headings can we expect to hear when we're working on a history and physical? A consultation often has the same type of headings. As you can see at a glance from the medical report formatting chapter in the course material, we might hear a reason for admission, a chief complaint, history of present illness, past medical history, and so on. We're going to discuss each one of these. Now, believe it or not, this was a reason for admission sheet for a psychiatric asylum between the years of 1864 to 1889. The reason for admission heading provides a physical finding by the healthcare provider and not just the problem described by the patient. If you can see this screen, some of this stuff is so horrendous. What human beings that have lived through these time periods where medicine was coming of age, it's a miracle. Look at this one, marriage of son, pecuniary losses. Amanda found jealousy and religion. Yes. Exposure and quackery I'm seeing down there. These are fever and nerves. As if they're, they correlate with one another. Of course, nowadays it would be hopefully much more sensible. What are reasons for admission? Late carbuncle. Oh no. A carbuncle will get you sent to the asylum. That's pretty scary. Oh my gosh. Then we have the chief complaint, which is similar to the reason for admission, but it's what the patient tells the doctor that's wrong with them, okay? So these are lighthearted examples of the patient's chief complaints that have been documented. One is felt, couldn't get up. How about this? DVD, left leg. Now, we all know what that should be, don't we? And I'm surprised the patient knew that much. I think I might have diarrhea later tonight. There's things crawling in my beard. I need my albuterol. My knee has hurt since 1983. No one can figure out why. And here's my favorite. I'm having a grandma seizure. For all you grandmas out there. Okay, then they come to your past medical history. Now, past medical history, they might just say past medical history and throw it all in there. That will include your past illnesses, surgeries, injuries, and other complaints. They may also make a new section called past childhood history, and they might talk about if you had chicken pox, if you have food allergies as a child and maybe you outgrew them, German measles, and it might include any surgeries you've had as well. Under history of present illness, that information describes the current symptoms the patient is or has been having. Certain body systems may also be discussed here if it's relevant to do so in regard to the current symptoms. You know, they'll talk about that you're coming in because you've had fever and chills, and then they might say you have not had any joint aches or pains or nausea or vomiting. That almost sounds like the review of systems, but if they put it in the history of present illness, that's fine. Then you'll find that they're going to dictate, they may dictate medications. These could be prescription, they could be over-the-counter, or herbal remedies you might be taking. The list provided under medications may be a partial or full list. It depends on the information the provider receives from the patient or another provider. This is where you might hear per EMR, which means per the electronic medical record, or when you plug in the patient's name in the computer on the hospital floor or in the office, you'll be able to look at their electronic medical record to see what medications they have been on or are currently on. Allergies is an important section. These allergies may vary and they will be listed if positive, and will require a bolded heading or capitalization of all allergies to provide ease and efficiency in locating and identifying these. Allergies may be environmental, prescription medicines, or herbal remedies. Family history. It is very important that the physician knows what's gone on in your family. It might talk about your siblings, especially people that you are related to. Your parents, your siblings, your children. Spouses, I'm not sure what that has to do with anything, but perhaps if your spouse is ill, you know, that may be taking a toll on your health as well. A specific issue may be genetic or age-related that may cause further questions to be asked. For example, if you're having a chronic cough, the patient you may be asked if there's any family history of asthma or bronchitis. Or they may ask you if there's a history of smoking in the home, secondhand smoke. You know, it could go for a lot of things. Social history, you may hear them talk about alcohol use on the weekends. Maybe they have recreational marijuana. Maybe they drink once a month. You know, they will include this to see if the patient has a use of alcohol, smoking, or illicit recreational drug use. They may also ask what type of work you do, because when asbestosis and, why can't I think of that word, the mesothelioma, if people worked in old factories where there was asbestos exposure, that could be a cause for mesothelioma or a certain type of lung cancer. Sexual history may also be included in this section. Now, the rest of the major headings you may hear dictated in H&P include the review of systems, which has to do with body systems. We'll get into that more. The physical exam, lab data, your diagnosis, and plan. Now, the review of systems, so you have a gastrointestinal system, a genitourinary system, a respiratory system. That's what they're referring to. This would be different than your physical exam where they would say lungs, or pelvic. They use different terms. The review of systems can be brief or in great detail. This section may be referred to as the review of systems. It is a summary of positive or negative symptoms for each body system. These are what the patient answers to the doctor or the healthcare provider who's examining him. The review of systems comes from the patient. They're going to ask them questions, and that's what makes up the review of systems. So the difference between that is the information is provided by the patient in response to questions from the healthcare provider, but the physical exam is information obtained by the healthcare provider as an objective examination is done. So, if you're at the doctor's office, one of the questions they might ask you about your general or your constitutional systems would be, how have you been feeling? Okay? With eyes, you might have come across any blurry vision, any double vision. Ears, nose, and throat. Do you have a stuffy nose? Do your ears itch? Cardiovascular, they could ask you if you've had palpitations. Have you had fast heartbeats or skipped heartbeats? With respiratory, are you short of breath? They'll say, if you walk across the parking lot, would you be out of breath? Gastrointestinal would have to do with stomach upset, GU, dribbling, slow stream, nocturia. Musculoskeletal, they might ask if you've got weak muscles. Skin and integumentary, rashes, unusual hair growth. Neurologic could involve dizziness, numbness, tingling. Psychiatric, mood swings. Endocrine, heat or cold intolerance. Hematologic or lymphatic, unusual bleeding or anemia. That's creepy without the hand. Oh, you're funny, Lynn. So, one of the last things we have with our allergies and immune systems can be seasonal allergies with the change of seasons. My daughter is allergic to seafood. Okay. My other daughter developed a tree nut or apple allergy, peaches, pears, anything with that solid pit in it. She developed that allergy when she was in high school, believe it or not. And then, of course, my husband has Timothy grass allergies, and a lot of people may suffer those other types of allergies as well. The physical examination, here is the bread and butter. It usually begins with vital signs and then moves downward from head to toe. I always suggest that you think of yourself sitting on the examining table. And as the healthcare provider examines, you from your head, eyes, ears, nose, throat, chest, he will be documenting the findings. The body is examined as a whole, and each section is examined and described separately. The physical exam will contain subheadings if it's dictated in a subheading format, and each part of the body that is examined will be discussed. The most common subheadings are on the next page, and they are not exhaustive of what you can expect to be dictated. So this physical exam that we're looking at is one that has been put in stacked format. Now, in most of our reports, I don't know if I've ever seen the word general used as a subheading. I've never heard it dictated, but they will say the patient is alert and oriented, or the patient is a well-developed person. So that would be on its own line if there are subheadings. And since there are subheadings here, of course, we're going to make the report stacked. Now, when we get to neck, anybody have any suggestions? Supple, good. What else do they look for in your neck? Think of them feeling around. What are they feeling for? Good, Judy, soft. They're feeling under you lymphadenopathy. Woo, yeah, JVD. Listen to you. Go. Lumps, yes. And what's that gland in your neck? Venous distension, that's good. There's a gland in your neck. Very good. Thyroid, thyromegaly, perfect. Okay, then we talk about our lungs, moving our way down, we get to our heart, and then when they get to the abdomen, what might they say? So you can anticipate benign, yes. You learn to anticipate what they might talk about when they're talking about this abdomen. Remember, think of yourself, mass and tenderness, perfect. Think if you're laying on the table and they're pressing hard on your stomach, so hard that it hurts. Very good gastric sounds and bowel sounds. They're pressing so hard, there could be rebound tenderness too. Very good, you guys. And then when we get to neurologic, as you see, good, guarding. That's like, get your hands off me, go away. So neurologic shows cranial nerves, blah, 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 to be, what will we say about the cranial nerves? And how many are there? 1 through 12, good. That's another question. Remember, if they say through, we type the word through. Good, Micah. If they say 2 to 12, then we can use the hyphen. Very good. And it can show the cranial nerves 2 to 12 to be intact, within normal limits, many things. Now, this physical examination is not stacked. And we could talk more about the neck if you came up with anything new, but I think we covered a lot of that before. And you know that whether or not you stack the physical examination depends completely on how the physical exam was dictated. According to the CanScribe account specifics, if a subheading is used, you need to place each different topic on its own line. If the entire physical exam is dictated with sentences and sentence fragments not requiring a subheading, you can keep the report in a paragraph form as you see above. Anticipating what will be dictating in the physical exam will be a skill you build over time. Once you get over the shock and awe of what to expect when you put those headphones on and begin listening to your dictation, you will wonder what was so ominous in the first place. Well, maybe not completely. Keep in mind, while you're transcribing the report, what brought the patient to the doctor in the first place. What was his chief complaint? What did they talk about in the history of present illness? What has the patient undergone in the past? It's hard to keep it all going and all constant in your mind, but that's what you're going to be drawing on as you transcribe the report. Think about your words. If a patient has high blood pressure, it would make sense that his medication regimen would include antidiuretics, water pills, statins, cholesterol-lowering agents, and pills to actually lower blood pressure. You know, the more I think about it, I think that should be diuretics, not antidiuretics. I don't know if I've taken leave of my senses, but if anybody can look up antidiuretics while we're on the subject, let me know if you can do a fast Google what it says. And then you can also be on a blood pressure pill that actually lowers your blood pressure. It might have all those other little things mixed in. Always verify your meds before you put it in that report, your labs, and any abbreviations by doing a quick Google. With medications, always check the dosage and generic and brand spelling while you're researching. It will pay off in the end and save you valuable time. Okay, Micah got the answer. An antidiuretic is a substance that helps to control fluid balance in an animal's body by reducing urination. Opposing diuresis, it affects the opposite. Thank you. So that's when we don't want them to lose water. That's what I thought when I had the word anti in there. I'm like, what did I do? Thank you. Very good. All right. Lab data. Information documented in the lab section may be from previous studies and lab work done at alternate facilities, emergency rooms, and clinics. The most recent should be listed. I have worked on an account where the patient's medical record was actually there and live for us, and if we didn't understand what the doctor was saying, we could actually look at their lab work and see what test he was referring to and what the real number value was. So that was very nice. Assays are specific test panels, and their results should usually be kept together when transcribing. When a different panel of test results is being dictated, that should begin a new sentence. So the example there shows CBC, which means complete blood count. And it has to do with anything in your blood. It has to do with your hemoglobin, your hematocrit, your platelets. Okay, so when he gets off of blood items and he starts talking about sodium and potassium and chloride, those could be electrolytes, minerals. They're different. So they would have a new sentence, whether or not there's a verb. AST and ALT are high normal. Those are liver tests. And BUN, creatinine, and bilirubin have to do with your kidneys. All right, where are the places we can find this information? Here are some lab data websites for you. I'm going to wait a while if anybody wants to jot any of these down. Lab Tests Online, LabCorp, I've used all of those. Mayo Clinic is a very reputable source, so there's Mayo Medical Laboratories. And most of these places you can go to they'll have a drop-down or place sites within the site, and you can go to test panels and look for the test that you want more information about. Okay, can I move ahead? Does anybody need the screen up? Okay. Now, once we've done through all of this, we come to the diagnosis. Once the evaluation is complete and all the documented information reviewed, a diagnosis is determined by the healthcare provider. As you know, if there's more than one diagnosis, the major heading needs to be diagnoses based on the CanScribe account specifics. Once we're done with that, and of course, if it's diagnoses, that means there's more than one, we need to number them whether or not numbers are dictated, because that's according to our account specifics. After the diagnosis is determined, a plan will be given. This will include steps the patient needs to take to resolve the current symptoms. The plan will usually include follow-up dates to monitor the healing process. Why do I have follow-up in red? Because follow-up can be a challenge for some people. Hopefully this might shed more light on follow-up. If you're using the one-word form, it means the word appointment. So give it a try. If you put it in your document as one word, try to replace it with the word appointment. And if it makes sense, you're using the correct form. My follow-up is scheduled for tomorrow. My appointment is scheduled for tomorrow. Follow-up as an adjective is also the one-word form or with the hyphen. You will see the hyphen in a lot of your answer keys. But the industry, you know, like with prefixes, we're going away from hyphens. Non-committal, we would make all one word. We wouldn't use a hyphen. Preoperative, we don't use a hyphen. So in order to make things easy on yourself, just keep it one word as an adjective. I will have my follow-up visit tomorrow. What kind of visit? A follow-up visit. Then we get to the verb. Follow-up, verb, 2 words. Think of 2 words takes more energy to hit that space bar and type 2 words. It's an action word. I'm going to follow up tomorrow. I am going to appointment tomorrow would sound silly, wouldn't it? So that's the reason why we know it can't be the one word, because we can't put appointment there. So it must be the 2-word form. And often the 2-word form will have a helper word like to follow up, will follow up, did follow up, and so on. Is everyone still with me? Any questions at the present time? I'm sure your minds are swimming with information and you're just teeming with questions. Any questions yet? All right, then we'll keep trucking along. Acronyms. What exactly is an acronym? And the acronym ACE and ACE bandage seem to be challenging at times. So in order to find out about acronyms, these are words that are transcribed with all capital letters. So ACE, all caps, is an acronym. The Book of Style tells us that all letters of an acronym are capitalized. But when they are expanded, we do not capitalize the words from which they are formed unless they're proper names. So, if you put ACE in your report, and you know, these are the different things it could mean. Annual Comprehensive Exam, Angiotensin Converting Enzyme, Antegrade Continence Enema, oh my. So, but when you want to transcribe ACE bandage, you only would capitalize the A in ACE because it's a brand name. Here are some more examples, because when you get to abbreviations and short forms and acronyms, it all can be very confusing. And I needed to find some examples myself. So when you hear initialisms, that means the word, you pronounce each letter. For instance, if you saw cabbage, CABG, which is an acronym for coronary artery bypass graft, we don't say CABG, we say cabbage, right? But if you see NFL, well, no, I don't want that one. ATM, automatic teller machine. Look at IDK, I don't know. But with acronyms, sometimes you don't pronounce each letter like we do on the right-hand side here. UFO. If it was an acronym, we might call it UFO. Okay? POTUS, President of the United States. GIF, Graphics Interchange Format. Now that makes a liar out of me because that should be all capped. I'm telling you. And then on the right, we have abbreviations. So, this makes sense. Approx for approximately, LB for pounds, PT for pint, DR for drive, and so on. Which still leaves us with the brief or short forms. Now, who can tell me, I would like you all to give me some brief forms. Now, they're not an initialism, they're not an acronym, and they're not what we saw as an abbreviation. What would you find in a medical report? The first one, a couple, pre-op, good. How about in vital signs? If they don't say the whole word, good Judy, good Micah. Temp, good Judy. Wilma, exam, very good. So you understand. And we never have to worry about expanding brief forms anywhere in our reports. Okay? Well done. Meds is another one. What else might we see? WT for weight. Yep. All right. Good job. Rest, yes. Okay, how can you tell when something is a brand name? So we were talking about Ace Bandage. Now, if you Googled Ace Bandage, this would be very misleading because it shows the word in all caps. But the fact that it has TM after it means trademark. It means it's a brand. Now, most companies want to capitalize their brand, okay? It doesn't mean it's an acronym. It means they want to capitalize it that way to draw attention to themselves. Always remember that the brand name is the manufacturer's name for a product. It's the trademark or proprietary name. When it comes to this, we know it doesn't mean angiotensin converting enzyme brand elastic bandage, right? So we need to just use a capital A and make everything else lowercase. Capitalize the initial letter of the trademark or brand name of drugs, sutures, instruments, etc. In the case of oddities such as Physohex, where there is eccentric use of capitals, it's acceptable to either match the manufacturer's presentation or use initial capitals only. However, if the manufacturer uses all caps and it is not an acronym, then just capitalize the first letter. Can anyone think of any medications that we type with oddities? Like Physohex? The one that comes to mind for me is Miralax. Very good. Very good. All right. Here's another thing you might see. This will give you an idea. Dayquil. Thank you, Dawn. Good. Trademark, TM, registered, symbol, another symbol. These are how you can tell these things should be capitalized. Now, when you go to drugs.com and you Google metformin at drugs.com, you'll see generic name, metformin, lowercase, brand name, Fortimec, Glucophage, da-da-da-da-da. I have seen, I think it's at RX List, that's another drug site, where they'll say generic name and then they actually have it capitalized. Please know that if it's generic, it's never capitalized. Don't trust them. You can trust them for other things, but not this. Okay. How can you check out if something's an acronym or what it means and how you need to format it? You can try these places: MediLexicon, Merriam-Webster.com Medical, Medabbrev.com, MedicineNet, and Tabers. Often we are so excited to begin transcribing that we forget to observe what is on the page where we'll be doing just that. When you're in DictoScribe, above the audio toolbar, you will notice blue text. When you click on that text, a document will open with that title. Click on the account specifics to open them up. They will remain open throughout your shift no matter how many reports you do. This is a searchable document. You can use your control key and the letter F for find. When I do it, I have to do control FF. Once you do that, the account specifics will open up for you. Now you can search with this control FF and it opens up this search box. You can see I have the word blank in there. So I wanted to know what I'm supposed to do with a blank or how to format a blank. And when I type the word blank in there, it shows me that there are 12 instances of the word throughout the report. And at the very bottom, it's highlighted in orange, and it tells me what to do with a blank. A lot of people like to print the account specifics and have them so they can touch them. They like to feel the pages and search that way. That's fine. Do whatever works for you. But you know that when we click on things, a lot of times it's much quicker. But your way is fine if it works for you. Okay, remember when we're verifying information, you might say, but the book of style says this, but we say, but the account specifics say that. That's because there's a hierarchy of information. Number one, the account specifics. They come first. They trump the course material, but that comes second. Both of those trump the book of style. If you don't find what you need in the account specs or the course material, go to your book of style. And as we work our way down, we've got school-issued resources, which would be Stedman's and the Quick Look Drug Book. And then internet resources. Ensure the integrity and authority of specific sites. If you can't find a rule above that addresses your question on transcription, refer to the book of style. Okay. Most reliable websites. Good old Google. You want to know what's reliable? Google will tell us. Just search for it. Here are 8 credible user-friendly health sites. As you can see, the National Institutes of Health, American Diabetes Association, Mayo Clinic, drugs.com, and so on. Another way you know is if you go to the bottom of your page and you see this HAN code. It means Health on the Net Foundation, And if you see that at the bottom of your web page, you're good to go. Here's another one. You might see ADAM at the bottom, and this one was just full of everything because it had all of that. It had EBIX, ADAM, and the HAN code with it. Can somebody tell me what time they have, please? When I'm in this, I can't see. Oh, it's 10 minutes till? Oh, we're almost done. Okay. So, okay, thank you very much. What is critical thinking? This is very important, and this is the last thing I want you to remember. Critical thinking is the ability to think clearly and rationally and understand the logical connection between ideas. This has been the subject of debate since Plato and Socrates used to hang out in Greece and just discuss things, so they had nothing better to do. It's also the way we would know how to recognize fake news. Isn't that trendy? Critical thinking might be described as the ability to engage in reflective and independent thinking. You'll hear this mentioned often in medical transcription. It's one of the most valuable skills you can bring to the table. Given the amount of knowledge you need to do the job well, it's surprisingly easy to develop the ear-to-fingertip skill that seemingly allows words to go from the ears straight to the fingertips, bypassing any thought process, right? We just want to get it down on paper. Ever get to the end of a report and not remember a single thing about the patient? It's almost like when you're driving and you don't remember how you got to the grocery store, but there you are. To avoid this mindless state and create an accurate report, one must strive to remain engaged, apply critical thinking throughout the transcription and editing process. As a critical thinker, you will ask relevant questions and look for evidence to support your assumptions. As an MT, critical thinking involves the 3 Ds: doubt, don't believe what you hear or see, discipline, and decision making. Doubting your ears can be the most difficult skill to cultivate. We're accustomed to trusting our ears. How else would we transcribe or edit if we couldn't hear the report? We finally get your listening ear formed, and then we tell you not to trust them. Your ears may deceive you because there are many sounds that simply cannot be discriminated. A sense of doubt will prompt us to ask questions to make sure we're using the right word. We must also doubt our eyes. When editing a speech rec report, we should not necessarily believe what we are seeing. We must rely on our ears. Sometimes it's good to close your eyes, listen, and compare what you heard to what you see on the page. Discipline compels us to pause and ask these questions based on the context, and well-informed decision-making follows. Time certainly flies. I can't believe our session is done. I want to thank you for joining me for a little bit of this and a little bit of that. Remember to keep utilizing the tools you have at your fingertips. Keep researching and filling up your fund of knowledge. Keep using your critical thinking skills. We all learn something new every day. Isn't it wonderful? Well, Mr. Dembones and I would like to thank you for joining us today. Remember that everything we've discussed can be used in any report type and with any specialty. Keeping your medical transcription tools sharpened and your medical resources handy will spell success for you. Have a wonderful day. Thank you, everyone. Thank you. I wish you all the best. Our session is complete. Thank you all.